Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And right off the jump, Lynn, I'd just like to ask, since we wrapped up the previous Health Matters talking about you heading out and heading up the street to the homeless walk-up clinic that happens here in on Elk Valley Road, how'd that go?
It was so fun.
What was fun about that?
Well, of course, we hit a new high in number of patients we were able to help.
Really?
So potential for 14 and a couple wandered away. So ultimately 11. But it's interesting in that there's a little bit of change in the patients who are coming.
Uh-huh.
Some people who are housed and who have reliable transportation and are patients at Del Norte are just showing up. And some tourists are just showing up. It's almost like a walk-in clinic.
Wow.
Yeah. And so I can't always help people with, ongoing primary care stuff, but I can be a connection to other resources that the Del Norte community has.
So first off, I'm curious as to where tourists are finding out this is happening. That's wonderful.
Pharmacists, I think.
Are the pharmacists telling them?
Because I told them all.
Okay.
Also, the ER, and it's against the law for the ER to refer anybody who presents to the ER for care out of the ER. That's what they call an EMTALA, or federal violation. But they can post the advertising signs and just kind of like point at them, and then people figure it out.
Really? Like healthcare's that away kind of thing?
Yeah, it's just like, wow, did you hear that there's a walk-in clinic on Saturday from noon to 2?
So, I mean,
10 to 2, sorry.
I mean, I know that the population in this neighborhood, and the homeless population specifically, would require a lot of care and are sort of far away from where that care is here in town. But there's a neighborhood just right over there across Howland Hill that is, Waldo and back in there working toward the Birch Tract. That is, it's one of those classic Del Norte neighborhoods where every other house, you've got the whole spectrum of Del Norte experience. You've got, nice houses and kept up, and others that aren't. Right. And if I live in this neighborhood too. It would be, really easy and tempting to I've got a question, I can walk over and just talk to somebody.
It would totally be. Although your answer may not be there, but it would be like walking through an open door.
Well, I know, huh? What?
Oh my God!
Easy access.
Yeah, and so I'm not always there, and there's provider tolerance of what they feel like they're able to do.
Sure.
And the physician that works there actually doesn't. He's doing it for volunteer, so he's the main guy, and I kind of, drop in every once in a while when he's off doing something else. So I like to be the open door to services. But a lot of times people need stuff that's not really there.
What sorts of issues can you deal with at the walk-up clinic? And what sorts can't you deal with?
I would present anything that's not like immediately life-threatening.
Sure.
Yeah.
Well, yeah. But I mean, what do
we usually see? What can we do the most?
No.
For?
What sorts of issues that are presented to you that you have to go? We can't deal with this here. You need to go to your PCP.
Right. Well, I can take care of part of a problem. Let's say somebody needs something that needs blood drawn. Nobody draws blood.
Okay, yeah, that's sort of gotcha.
But I'm kind of like no barriers. I think it could be a starting place for a lot of different things.
Sure.
So, but if somebody said, "Hey, Dr. Pearson told me that he ordered blood tests for me to check my kidneys."
Got nothing on that,
yeah I got it. Nah, but
see now, if the whole universal medical records thing wasn't a lie and was actually truth. I mean, that would be a situation. You could do that, right? I mean, you'd be able to do that. You could call up someone.
Well, I think they also need a person that can draw blood there and maybe some refrigeration. But but they got that. As you noted, the dental coach is pretty impressive. Yeah, so they do have access to some of that. They don't have somebody actually draws blood, but I could do that.
Yeah.
But here's an example of how they responded to needs. So there's a lot of syphilis going around this part of town. And so having somebody come into the clinic to get their syphilis test might be beyond somebody's ability to do that. So they have actually a rapid syphilis test.
Oh, wow.
Not super accurate because it's a screening test. A lot of false negatives, but if you got a false positive, that's kind of a live one,
Right.
And they could actually treat somebody based on that, and they have. They've been treating a lot of people, so they got a bunch of penicillin. They have portable refrigeration, stuff like that.
And I bet, I mean, when the vehicle comes down, right? When that's being built, I imagine all of that. Yeah,
that's February, I hear tell.
Wow, right on. Yeah. Okay. Well, I just wanted to check in with that because it was exciting. I saw the dental RV go by and head out there, and I was going, ooh, that looks neat, and I wanted to know what the scene was out there. And I know I got a very nice text invitation to come down and check things out, but it was Sunday afternoon. I was done.
You were out of here.
I was out of here. I was just over there, but yeah, I was out of here.
But you know, the other thing they had too is they've got tables full of stuff that that could be helpful, like for a first aid kit or you know, they have Narcan or Plan B or, you know, things that you can eat that make sense if you're not housed. Or dressings and things like that. If somebody has, you know, a lot of unhoused people walk a lot, and so they've got a lot of foot issues. All kinds of sunglasses, everybody, and they were cool. They were left over from Open Door Fest, which happened in Blue Lake a couple of months ago. And, you know, they're super reflective and very trendy. So, you know, a lot of those disappeared. And then, of course, Open Door donates food and clothing. The employees of underpaid Open Door donate stuff out of the goodness of their hearts. Hot items are things like towels.
Oh, I bet. Ooh, I know. That never occurred to me.
I know. Socks.
Well, socks, yeah, that's
a perennial favorite.
That's a no-brainer. Yeah, but towels, wow.
Towels, yeah, super big deal. They disappeared really quickly.
I bet. Wow.
Yeah, but and you know, there's a lot of shoes and stuff that people get, used shoes and things like that. But they were grilling dogs on a propane grill, and they had all the fixins and chips and you know, cookies and all kinds of stuff.
Is Mission Possible there every time?
No, no. She showed up for like the first 2 that I was there, which might have been the first 4 that it existed, and then we haven't really seen them.
Well, I know that they had they now have their I forget what they're calling it, but just right there in the old hamburger place out front, they've got some sort of staging thing where there's actually a place they man now on a consistent basis.
Yeah, so I think they were important to introduce us to the community, and now people decided we're cool. Yeah,
good.
And we see the same people kind of over and over and over again because they have, you know, ongoing wounds or something like that, or dental problems. Such a big deal. Such a problem to be in this beautiful mobile dental van and have everything you need except a dentist.
Wow.
Yeah. So,
I don't know. I don't know what we need to do to attract more qualified healthcare people to our community. I'm thinking maybe it's like we just go to larger cities and kidnap them, and then, you know, hope for the Stockholm thing to set in.
Yeah, right. I don't know. Maybe get people like, do you remember Vista? Kind of the Peace Corps. There was a Vista.
Oh, right. Yeah.
Yeah, and some people who are winding their careers down, but maybe still wanted to be of service, and they had skills that were useful, like retiring dentists. There was a retired dentist pretty much who worked here for a long time.
Wow.
Yeah.
Is there any place, any dynamic, any rubric in place for you know, you get out of medical school and you got to pay off all your hundreds and thousands of dollars of debt. And
they do that.
Do they still? You can work it off, you know?
It's a tricky thing because if you don't, first of all, it's for 2 years. That's why the turnover at the community clinic every 2 years. So
is that what happens?
It's a short-term solution. The problem doesn't seem to be sticking really well. But the other thing is, what if you land somewhere and you were like not a match? You have a 2-year obligation. They can send you anywhere.
Wow.
And so people are a little reluctant to end up somewhere that's just not compatible for their lifestyle, their family. So it's a thought.
Yeah.
They have kids to educate or something, and they end up somewhere where there isn't that.
Yeah, exactly. Yeah. Wow.
But yeah, it was super fun, and I'm just the fill-in person, so in my practice style is no rules. They're starting to call me No Rules Szabo. So there might be rules when Andrew, who's the physician who's doing it,
who's called rules,
he might have
Andrew.
more sense. But it never hurts to ask. Okay.
Yeah. Oh. All right. So that was just catching up. This week's episode is actually about RSV. What's RSV stand for?
It's Respiratory Syncytial Virus, and it's definitely a yearly visitor to the Del Norte community. Causes maybe more than once a year. I see smaller waves of it maybe at the end of the into the spring, but definitely shows up around the flu season, COVID season. So around November, December, and probably into February, March. It's really hard on the kids. It causes what's called a bronchiolitis, which is not a bronchitis, which is not a reason to get antibiotics. Okay.
Okay.
It's a viral syndrome, causes lung disease, really transmitted similar to COVID and flu, respiratory inoculation. But the deal is with the little kids, they get a lot of congestion and a lot of problems breathing, and it's super scary to watch in a little baby.
Wow.
So the super exciting news is that although it's not treated with antibiotics, there's a lot of interest right now in A, preventing it, and B, either prophylaxing or treating kids that might have comorbidities or other risk factors that make them really vulnerable to being super sick from this. The same thing on the other end of the age spectrum, the elders who have comorbidities, who are frail, when they get this, they have similar problems. They can't keep their airways clean or clear, and they end up getting what's called hypoxia, which means low oxygen levels, and they struggle to breathe, and it's really awful.
Oh, wow.
I mean, respiratory drive is primordial, right? It's
Right.
like one of the first things that I guess animals, and if you think of evolution, it's one of the first major life processes that showed up. And when you can't do it, even your little reptilian brain is in a total panic.
Sure.
Yeah.
Is this, and this might be a question for a different place in the discussion, but is this a new disease?
No, we've had it around forever. And it used to be you would go down to walk-in and, your kid was coughing. They would call it bronchitis. They would give you Zithromax. Nobody really got better quickly, but eventually they got better. And now people are kind of certain that they need antibiotics to get better from it.
Sure.
But that's not really, we understand it better now. Okay. It's not bronchitis, it's bronchiolitis. And so what that means, bronchitis means the upper airway, an illness that affects the upper airways.
Okay.
Bronchioles are the lower airways.
Oh, okay.
So super more potential for badness.
Because it's down deeper in there.
Yeah.
It's more prime. Okay, so was it just a matter of... So I just want to understand.
I think we understand it better. I think we recognize it better. I think we can test for it better, and now we can treat for it better.
Gotcha.
Yeah,
And that
that's what's
happens a lot.
happening. This is like the renaissance of RSV. In
Okay.
Delnort County. So, and the reason it's important, especially here, because high risk of disease and complications in the native population for some reason.
Huh.
And they don't really know why.
They're not understood. Wow. Okay.
Yeah. So, so things to do in general are to, avoid close contact, greater than 6 feet, social isolation.
This sounds familiar.
Possible, yeah, I'm flashing back. Cover your cough, stay at home when you're sick, wash your hands, and avoid cigarette smoking. But for certain individuals who have other diseases that make them especially vulnerable to a severe case of RSV, there is prophylaxis, and then also treatment with antivirals and monoclonal antibodies.
Wow. Okay.
Yeah,
Okay.
so that's super new and that's super cool.
Is this a coronavirus?
It is not.
Okay.
So, but there's what the whole reason I'm talking about this today is that since maybe about March of this year until recently, there's been a lot of movement on okaying vaccines, new vaccines. Everybody's so excited. New vaccines for this particular illness. And not only can we protect younger infants, pregnant women and elders, also the native population or whether subset, wherever all that overlaps. Super exciting. And the names are hysterical. I don't know who makes this.
So let me be clear about this. Was there a vaccine before?
No.
Okay.
No.
Okay.
So the adult vaccine is going to be hard to pronounce.
I'm just waiting for you to read these. Go ahead. You're on your own.
It looks like a Breezvo for adults.
A Breezvo, yeah.
Breezvo. And then for kids, a RXV.
A Rexv?
A Rexv. What does that sound like? RSV. Boy, gold star for whoever made that up. So Arexvy is made by GlaxoSmithKline, and Pfizer is responsible for Brexvo. I don't even think it has an X in it.
No,
Yeah.
that's okay.
It's hard to say. So, but there also are a ton of vaccines coming out and being okayed like here and there. So I think there's going to be a bunch that land here, and what we get is kind of what we get, but also there's going to be some competition for what's the most effective. Now, lest that somebody says, oh, this is just more messenger and brand new technology. It's not messenger RNA,
This is
and
an
it's
old
been in the
school.
works since the 60s.
Wow. Okay.
So this is nothing new. This is fruition. This is science at its fruition. So it lowers the risk in adults by 67 to 84%. So 67% getting sick at all, and 84% lower risk of severe disease in adults.
Okay, so the way that's written out here, it makes it sound like it lowers it to, and I want to clarify that, at least if only for myself.
Okay.
It lowers it to like only 67% of adults will get sick.
No,
That's not-
67% of adults will not get sick.
Yes,
It's the opposite. Sorry.
exactly,
And
exactly.
84% that could have had risk factors to get severe disease will not get severe disease.
That's amazing.
Yeah, those numbers are super good. And the other exciting thing, super safe and effective in pregnancy by providing protection in newborns. If pregnant women are immunized, probably my guess is it's going to be last trimester.
Wow.
Yeah.
And it would cross the barrier there. Yeah.
Right.
Wow.
It crosses the placental barrier and probably provides, although I didn't see specific data on this, probably provides passive immunity through nursing.
Okay.
Yeah. So what does that mean here? Well, RSV and Del Norte, our kids get sick, and they've always gotten sicker for reasons I don't understand up here compared with Humboldt.
Really?
I don't know why it is.
Huh.
Yeah, no idea.
Oh, that's an interesting topic. Okay. Wow.
Maybe I would say native population, but there's native population in Humboldt County too. I don't really know why. And I don't think anybody will spend the time to figure out.
Are we that much poorer than Humboldt?
I think so.
Yeah.
But we haven't identified that necessarily as a risk factor for worse disease. So that might be irrelevant. Our access to care thing might be a deal.
Yeah.
Yeah. That I think is bigger. And I think you should talk to your provider personally if you're an adult over 60 who's interested in this immunization, or you're a parent and you're interested in your kid getting it, or you're a pregnant woman and you're wondering what the role of immunization in general is for last trimester of pregnancy. So how can you protect your kid, especially if your due date is like in the middle of February?
Oh, right. Yeah.
So I've got a few of those in my practice I'm sure we'll be talking to. Do not expect to see this out until the beginning of 2024.
Okay.
So we're going to have some disease and we won't have access to this vaccine. But I think this is going to become more of a useful tool in the 24-25 season.
So
super exciting.
So just currently right now, though, say your kid gets RSV, you get RSV. What do? You just simple thing, rest.
Well, you hunker down, you call in sick, you rest. There's no cough syrup you can give to a kid under 6. That's really very helpful.
Wow, okay.
Honey is somewhat helpful, but you can't give it to any children under 2.
Right, because of bacteria or possible bacteria in honey.
Even the homeopathy stuff that they market, that is not marketed to reduce kids' coughs. That's marketed to keep a corporation going. So I know
It's a very specific focus
parents
group.
look so traumatized when I remind them of that. It's really not going to help. So probably pay attention to things your grandma would tell you to do. So fever control, tolerate a fever up to about 100.4.
100.4, even in children?
Yeah.
Okay.
Unless the kid is miserable or has a history of febrile seizures. And, elevation. So it's not just pillows. Sometimes babies do a lot better in a car seat than they do in a bassinet.
Yeah.
Try and put pillows, for an infant, try and put pillows underneath the mattress of the bassinet, because otherwise, and don't make it too high, otherwise the baby's just going to roll into a ball at the bottom. You don't want to put it under the baby because you don't want any smothering risk.
Gotcha.
So under the mattress. And then, humidifiers and vaporizers, they used to be covered by Medi-Cal, and they used to be way more available. And now usually what happens is parents either have one because they have older kids, or they, they prevail on grandma or something to get one because they're super expensive, I think.
Wow.
Way more than they should be.
I had bronchitis as a kid. My folks made me hold my head over a boiling pot of water.
Right. You can steam them. Probably safer for an infant just to run a hot shower in the bathroom and then
there you go.
sit outside the shower stall with the
Not
infant,
in the shower.
not in
So,
the shower stall.
why does that work? That's never made sense to me. Why does moist air help?
Steam is a bronchodilator.
Oh, okay.
And you would think, why would you do a humidifier? So humidifier is moist, cool air, and vaporizer is moist, warm air.
Okay.
So you would think, we live in a humidifier in the winter. Why would you have to have a machine that's, especially if I have mold creeping up your wall? So, but really, if it's localized, it's actually quite helpful.
Okay.
Try not to put stuff in it. People always want to put lavender in it and Vicks and stuff. I don't think it would hurt anybody, but it's unnecessary.
Okay.
Again, that exists to make somebody money.
Oh, wow. Okay.
Not to help sick kids.
Which exists to make somebody money?
The Vicks and the lavender. And,
okay.
yeah.
But not the humidifier. I wanted to.
No, the humidifier's good, but
Okay, gotcha.
we also have our own humidifier, but it's kind of cold outside.
Yeah,
so. But yeah. And then make sure it's important to clean vaporizers and humidifiers in between use. So what I used to do is, because they have 100 little plastic spicules and nooks and crannies and things, I used to blow dry mine.
Oh, okay.
Because I could never get it dry enough for my kid. So. Yeah.
Are you sure your blow dryer wasn't blowing a bunch of nasty stuff?
I know. I try not to think about that. But when you're a new mom, stuff like that hits your brain.
Yeah, but when you're a new mom, you can just lick it and it's clean. The way that
pacifiers off the floor.
Sure, and and mother spit is like a universal solvent. It gets stuff off your face or wherever. Yeah.
Too bad it's not a tranquilizer.
Yeah.
Not that new moms are unnecessarily anxious, but it is very hard to have your heart live outside your body.
That's tough, right?
Especially for a new mom who's first child.
Oh my God.
Yeah. They never see that coming.
Oh wow.
So, but it's amazing.
That's an interesting topic there too.
Yeah, it is.
As a mother, do you ever get do you habituate to that?
Having your heart live outside your body? Mm-hmm. Oh yeah.
Yeah. You have to.
You
right?
can't really go through the teenagers without either losing your mind or coming to peace with it.
Right.
I put golden light around him when I'm worried about him. That's That's the only thing I can do at age 31.
Yeah. Well, yeah. That's all you got.
Yeah.
Wow. Well, I don't know. I don't know what else to say about RSV here.
Talk to your provider. It's not available yet. We could use less of it. It would be super great to get immunized.
Are you seeing any sort of vaccine shortages? Any sort of or medicine shortages? The way that nationwide we've had things. What was it? Maddie was telling me that people who have who get what's the ADHD medication?
Oh, Adderall?
Adderall, who have an Adderall prescription. There's an Adderall shortage. And so now they're getting Wellbutrin.
No, that's not what's happening.
What's happening?
That's the superficial observation.
Okay.
What's really happening is
asking.
A lot of people are getting put on Adderall for no clear diagnostic reason, but they found somebody that would agree to it.
Okay.
Yeah.
Okay.
And providers, when they prescribe Wellbutrin for adult ADHD, it's an attempt to not prescribe speed.
Wow. Okay.
Because Adderall speed also gets diverted a lot for illicit drug sales.
Oh, that might be. Oh, so that's
diagnostic confusion, inappropriate prescribing, diversion for, what does that sound like? Oh my God.
Money making?
Opioids.
Money making.
Right.
Yeah. Okay.
Yeah.
Pick your opioid.
Yeah.
Your opiate.
Yeah, totally.
I actually want to suggest this, that perhaps a really, really interesting topic for a future Health Matters would be specific healthcare concerns or health concerns of the Native population in Del Norte.
Okay.
Like the things that I had no idea RSV affected Native
Right.
folks differently or more intently or more
Right.
intensely. That sort of thing. Because that's just a kind of a blind spot, of course, to me, not being a native person, but
You know,
still.
it'd be nice to actually take it a step further and understand how UHS really works on an administrative level.
Because
healthcare is a treaty right for them.
that's interesting.
And
Okay.
I don't think people it took me a long time to get that.
It's applied in a different way.
Right.
Just healthcare is applied in a different way
It
and is applied
is.
as a right and not as a privilege.
Exactly.
Wow,
Oh
okay.
my God.
Oh my
Mind
God.
blown. And they should speak to that themselves too. So I could see if there's an administrator who'd be willing to go on the air and talk about it.
Okay.
That's their story.
That sounds good.
Yeah.
That's just a suggestion from the many times that we've had conversations, and something happens and it affects Native people differently or other populations differently, and that's just something I think a lot of our listeners and a lot of folks here would be interested in hearing
Okay.
here in Del Norte. Okay. So what's coming up next week with Health Matters, Lynn?
I'm still interested in getting Michael Fratkin to come on again and explain his citizen scientist research that he's proposing. So I'm going to connect with him. And I like your idea, actually, about UHS, how it's different in this community from Del Norte Community Health
Well, that
Center.
was your idea. My idea was just, hey, what's affect Native people differently? And you're all like, let's talk about UIHS. And then I'm like, oh, wow, that's a great idea. So, yeah. I'd like to know. I'd like
okay.
the difference. And the
Yeah,
treaty right is
so-
really intriguing.
Yeah, I think they'd be willing to come on the air and talk about
Cool.
their, what makes their clinic special and why. So super exciting.
Wow.
Yeah.
That is really, really cool. And again, it's just funny. It's just all the barriers to healthcare and all the different things that are out there for different populations and poor rural people, Native people. How it can't be just the same for
maybe
humans.
We should talk about barriers to care. That would be like a two-parter, I think.
Oh, wow.
And how stupid they are.
Because we do hit barriers to care, but it comes up just incidentally with every topic that you come in with because there's always some barrier to care, right? Yeah.
There always is.
That's very good.
And they're largely unnecessary in my worldview.
All right.
So-
Well, Lynn Szabo, thank you so very much for all the knowledge and what you do here in Del Norte County, too. Yeah, let's talk next week.
Okay.